1, 2, 3, 4. Well, you got it.
I'm Ruth Noordegraaf. I'm the Director of Community Development, Wellbeing and IIDEA. Today, I'm here to tell you more about the Municipal Fee Assistance Program.
Hello, and welcome to Tell Me More, the City of Kingston podcast. This week, we're highlighting a city program that helps make things more affordable. And when I say things, I really mean a wide array of things, from the Grand Theatre to transit to extended healthcare benefits and many points in between. The program is called the Municipal Fee Assistance Program, which is a mouthful, so we also call it MFAP sometimes. And its purpose is to help low and moderate income households with assistance on fees for city services. So joining me to explain more thoroughly than I ever could is Ruth Noordegraaf, the city's Director of Community Development, Wellbeing and IIDEA. She's here to tell me more about MFAP. Ruth, thanks for being here.
Thanks for having me.
So let's start off the top. Probably a lot of people out there have never heard of this program, or if they have, it's just been in passing. So could you just walk me through some of the basics? What is MFAP and why is it needed in this community?
Well, MFAP, or Municipal Fee Assistance Program, is really a kind of a municipal discount program for people that are on low or moderate incomes. It's actually been around for about 15 years in our community. A lot of people don't know that.
Yeah.
And we're actually one of the pioneers in Canada for offering a program like that.
Really?
It's actually quite exciting because it really is focusing on how can we help people with the affordability of services that are not just like recreation or transit, but also cultural experiences, food, health, and even marriage license. So it's kind of really hoping to help people with the cost of living that obviously we're all facing and struggling with, but ultimately really focusing on like how do we make sure everybody feels like they belong in this community, they can access programs, they can take care of their health, they can take care of their connections and ultimately really focusing on how to build a more resilient and inclusive community.
Fantastic. Municipal fees sort of encompasses a wide variety of things, and we'll dive into that a little bit more in depth later. But could you tell me a bit about sort of what's involved in the application process? Like how, if somebody's interested in this program, what do they need to do to connect with it? Yeah,
great question. And it's actually it used to be a little bit more complicated, but it's been really, I would say the application has become much more accessible for everyone because a few years ago we moved to an online application.
Oh, handy.
Through our My Kingston system. And people can go online, fill out a few questions, obviously provide some of their income information because there is an income verification as part of this. And then in a few business days, they will be made eligible.
Nice.
There also is still, because we do recognize not everybody will have that capacity or ability to go online, there also is an in-person application through the Housing and Social Services Office on 362 Montreal Street. So, there are lots of opportunities. We also work with service providers that have information around this program that could help clients as well, or residents with the application. So we really want to make sure that people that can access this program do not have barriers in applying. And I don't know if you want to talk about like income and income measures and how all of that works, because again, like I mentioned, like there's only a few, I would say, but we are aware of about 20 cities in Canada that have a program like this.
When we say low and moderate income, but that's sort of a subjective term for many people, but I know within the context of these types of programs, it has often a very specific meaning.
And I will not go into all the details. I know there's lots of different ways of measuring income. Statistics Canada, for instance, is using a lot of different ways, but in Kingston through this program, and that's also one of the kind of updates we've made over the last few years. We're actually looking at something called the low income measure, and we're adding 15% to that. So what that really means, because I don't always know what that means myself, but let's say you are a two-person household, you would be eligible for this program if you are under $47,000 a year after tax as an income. If you're a five-person household, for instance, it would be $74,000 a year after tax. So that is really much higher than many of the other kind of low-income programs. And again, we really want to make sure that people in our community that can access this feel like they can through the different kind of application programs.
Back to that reducing barriers idea.
Yeah, and we know we have about, the numbers have gone up and down, obviously, with the pandemic and some changes over the years, but we typically see between 2,000 and 4,000 households accessing the program a year. But if we're looking at our households across the community and their income levels, we know that there are many more people that could benefit from this, and we really want that. We really want people to be able to use all those different services either for free or at a lower cost.
Incredible. That touches a bit on sort of the big question I had, because I know the program's been updated recently and that we've made some changes to it. Could you tell me a bit more about sort of what's changed? So we've got the online application process. We've we've increased the income thresholds. What else has changed recently with it? Yeah,
no, those are obviously two key ones. We also have made the eligibility from like a 1 year to a 2-year timeline. So you only have to apply once every 2 years.
Oh, wow, okay.
Which is helpful.
Yeah.
But maybe a few things around the actual kind of components of the program, because again, when it started, it was really just transit or affordable transit and affordable recreational programs. Over the past few years, we actually expanded the recreational program. So not only does every recipient receive $300 of a credit every year for each member of their households to put towards like recreational leisure programs. It also, in addition to that, provides people with free access to the fitness center, the free skating, or the public skating, the pools, and the water park. So it's kind of allowing you to access everything, plus then having a credit to do, for instance, swimming lessons for your kids, or a summer camp, or those kind of services. So that has been really, I think, meaningful for people. And then we've added some other components, and we might go into those a little bit later, but we have added health benefits for people that are low or moderate income for vision, dental, and prescription medication. We've added a food voucher pilot. We have a spay and neuter pet voucher, so people with pets can actually support their pets with their spay and neutering.
Yeah, it's so expensive to get that done.
All of that is like obviously like really important again to provide people with that connection in their community.
It also helps like make it easier for some choices that some people might have to make. Do I have to worry about feeding my family or the well-being of my pets?
Yes.
I know I struggle with motivation to get out and be active sometimes, particularly in the colder months, but when you have the additional barrier of cost on top of time, family, all that other stuff.
And we know. Again, things are challenging. Costs of housing, cost of food, cost of transportation, everything is going up. But I think so. It's obviously that part, but it's also we also know people can be isolated or lonely, and that is affecting people's health and people's well-being. So how do we again get people out and provide opportunities to do this? We're also with, to your question, like with the update over the last few years, last year, 2024, we did a review of the program. We've kind of really looked at how do we get the word out for this, and so people are aware, but also how can we utilize, our communication tools to actually reach out to recipients and continue to provide information and updates, and also obviously understand, the utilization of this more, so we can then also maybe continue to make changes and upgrades.
And just sort of create those lines of communication a little bit better so that you can help tailor the program as it moves forward and continually improve it. I like that.
Yeah, absolutely.
It also probably helps you adjust to needs that appear in the community that we might not have guessed before or that you hear back from.
Yeah, for instance, the food part is a new pilot.
Yeah, let's talk about that a bit. It's really interesting.
Yeah, no, and I think, obviously we know ultimately like food and food insecurity is something that we continue to see in every community. Like Kingston is not unique, and we also know that it's really the root cause of it is more of an income and access challenge, not so much, obviously we are very grateful for all of our charitable agencies that are supporting with adding food options to the community, but there's also a bigger conversation needed. So we recognize that this is not just the be all end all solution.
Right, yeah.
But we do have a really kind of cool partnership now with the local food stands through Lionhearts that is organizing that. So there's about 8 locations in the community that have like pop-up food markets.
Okay, yeah.
That provide healthy food, so fruits and vegetables and soups and other kind of healthy foods. And folks that are in receipt of MFAP can actually get every visit $10 worth of free food, which is really unique, and I have not heard any other city that has done this, and we're just starting, and we really want people to utilize that too, because adding healthy food to your weekly groceries is also going to continue to be a challenge for people.
It's surprisingly hard. Everybody says, eat healthy, it's tied to all these good health outcomes, but it's so much more expensive to eat sort of better quality foods than it is to just eat this more affordable shelf-stable items that you can get en masse.
Absolutely. And I know it's just, it's a pilot. We really want to kind of understand if people are benefiting from this. But also, again, this is a low to moderate income program. We recognize that people that might allow people to then spend the remaining, income on other components of their basic living. And so it's just really trying to kind of expand on people's income, on people's reach. I also think it's important to know that, again, like as a city, municipal government does not really have any influence on people's income, as in like we don't manage social assistance or social assistance rates or pensions, but we can look at like what are other ways through, for instance, this program to support people in reducing cost or improving access. So it's kind of cool.
This one's neat because it feels like it extends a little bit beyond just sort of fee reductions for municipal services and looks at how can we blend that into sort of gaps we're seeing in the community. And I'm realizing I've actually seen some of these markets. I swing by the Y and also the Rideau Heights Community Center, and I've seen them set up before. It's quite the thing.
Yeah, I think it's like really important that like this is a program. Everybody that's eligible for this program can access this program. So if it's if your household, if the number of people in your household and your income after tax are in line with this program, we really encourage you to access this program. There's no stigma. There's no everybody that can should utilize this program because it's providing you with amazing tools to access services, to stay healthy, to connect in the community, to bring your kids out, or if you're an older adult, kind of utilize our recreational facilities, take our transit system, and it's really meant for everyone. There's no stigma. There's no difference between somebody that accessing services through MFAP or not.
Yeah, I think stigma is a really good word in this situation because it can be hard to ask for help. And this isn't like a handout type thing. This is helping you participate more. It takes some of the pressure off a little bit. And
absolutely,
everybody, it seems, is being squeezed somewhere. And this is sort of a way to release some of that pressure and make it easier to participate in the other things that make community work really well.
Yeah, absolutely. That's why we're so excited about just getting the word out again. And I know after the pandemic, we obviously saw the numbers drop, and now it's just really great. And we've really looked at, okay, having an online application, having all these different tools. I know we've talked about the food program, which is an exciting pilot. I know we've talked about the health benefits piece, which is also a really important tool for some.
Yeah, we sort of mentioned that a bit. Health isn't a municipal responsibility specifically, so we're sort of filling in some gaps or helping people.
Yeah. I mean, and again, like for folks that are that are not on Ontario Works or Ontario Disability Support and are eligible for this program, there are opportunities to access through MFAP the Extended Health Benefit Program.
Okay.
I know there's lots of details about that on our website, but in essence, it could help you with accessing vision, dental, and prescription medication expenses.
Okay.
I know, I mean, that's pretty critical, right, for people, and it's a big cost.
And there are gaps that kind of currently exist, and for many people, I know a lot of healthcare boils down to, making sure you're taking meds at a certain time or that you can see properly, but those aren't things that are necessarily covered. So
and it's often for folks that are actually, that have a job but may not have benefits, and that can sometimes be a really big barrier to then, continue to take care of their health. Obviously we did have, the Canadian Dental Care Plan that came through and is rolling out. So we're obviously anticipating that with that we will be able to see a bit of a change in this program. And I will say this is one where it does, obviously rely on some of the city's budgets and the availability. Like if it there is a potential that we need to cap this. However, up until now, we've continued to be able to support everybody. We also have the annual benefit amount for this program had remained the same for the last few years. As of 2025, we're now increasing that every year based on the kind of annual, inflation through the consumer price index.
What is the annual benefit?
Right now, it's $700 for an individual and $935 for families.
And that's sort of funding that they can use to access health? Okay.
Yeah, so you would have like
general
an
level
amount that you could use for benefits. So for instance, for medication or for...
buy some glasses.
For instance. And so that will now continue to kind of go up every year with a small increase. So that's another really great program that has rolled into this and has been well utilized for sure.
Okay. So the other one that really piqued my interest, and if there's anything else you want to cover, happy to talk about that as well, but was transit, getting around the city, getting to work. Oh, that's so important for people.
Yes.
Could you tell me a bit about the transit benefits through this?
Yeah, I mean, I think, we have a pretty remarkable transit system in our community. I know there's been a lot of work over the last, decades, I would say, in upgrading and adding routes. And so obviously having the ability to access that at a very affordable rate is critical for people to get around to either work or school or activities. So through MFAP you actually can access a discounted monthly bus pass. I will say transit for youth, for kids, like under 14, is already free.
Right.
And for youth, it's often free through their high school or sometimes through post-secondary. But ultimately, through MFAP, if you are an older adult, it's $15 a month for a full access bus pass. And for adults, it's $20 a month. So it's still, there's still a fee, but it's much more affordable than the regular transit cost.
No, it's like the price of a cab ride or...
Yeah, exactly. And it's, again, like I think really allowing people to get around town and utilize services. And then there's another component to this. It's called the Transit Employment Program. It's actually, meant for people that might start employment either part-time or full-time. There's actually an opportunity to then access 2 months of free transit.
Oh, that's so great.
Just to kind of get you set up and through that initial, kind of time of...
waiting to get on payroll, get your actual checks rolling in and get settled. Yeah,
exactly.
That's so good. Okay, that's really helpful. So, I mean, for anybody listening who's interested in this stuff, we will put a bunch of notes in the chat or in the show description about where you can find some of this stuff. You can also Google City of Kingston MFAP or go to our website and search MFAP, or Kingston Transit has some information on their website as well, or reach out through Contact Us. Any of the old methods will work. Because, I feel like we're really just scratching at the surface of all the stuff that this program covers off here.
Yeah. Like you said, I think there's something for everyone in this program. We also obviously don't have to use everything in the program if you are eligible. You might just really want to access transit or recreational services. That's great.
Or the grant.
I mean, we haven't even touched on that. Like there's opportunity to get reduced Grand Theater passes for shows, which are phenomenal. There's an opportunity to go and visit some of our local museums. We are able to give you a 50% discount on marriage licenses. So it's really meant to kind of reduce some of the burden. And as I mentioned, like we also really see this as an opportunity we want to continue to have that back and forth communication with recipients. I want to continue to make sure that people that have access to this are able to apply. There's always things we can do better, so we're always looking for feedback and for opportunities to make things easier. I think as much as we recognize like people have a lot of pressures right now, income-wise, there's a lot of challenges out there. We really, as a municipality, are trying to make this through this program things a little bit easier, and we do truly believe that a connected community where people have access to services is a more resilient and healthy community. And I'm really proud that as a city we have this program. I think we can really celebrate that we're one of the few ones in the country that are looking at this kind of one window discount program and are really looking at this as a vehicle to access or provide people with access.
Yeah, I think that's maybe a great note to end on, sort of the community building aspect that this brings in.
Yeah.
When you're not worried about how you're going to eat or how you're going to get to work quite as much, you can participate in the other things.
Absolutely.
That make it worthwhile.
Yeah, and I'm also not going to say that this is the solution, but at least it's something we can do as a city. We obviously also need to continue to work on all these other bigger systems level challenges and work with the province and the federal government and all the different kind of partners to address these bigger issues. But at least sometimes it's good to know, okay, there's something we can at least try to build on and offer so we can remove some of the pressures.
There's something immediate while we work on the bigger problems.
Exactly.
That take more time.
Yeah.
Makes a lot of sense. Well, thank you for popping stopping by to talk about this today. I learned a lot.
Yeah, great. I'm happy to talk about this and looking forward to seeing as many people as possible utilize this program.
Yeah. Well, and thanks to everybody out there listening. If you, as I mentioned earlier, if you want to learn more about this program and how to apply, please check out cityofkingston.ca/MFAP for all the specifics on all the programs, all the options, and how to get in touch with somebody if you have specific questions. We'll also, again, leave some notes in the chat about some of the programs and options that are there. I also want to add that the city offers a wide variety of other programs and services for low and moderate income households. The threshold outside of MFAP and the thresholds to access these vary, but again, we'll leave some links to those in the episode description so you have some additional resources there. And if you'd like to learn more about this, what the city does, and check out some of our past episodes, last time I learned about our customer service strategy update and what that's all about. Before that, I spoke with Kingston Fire and Rescue about practical fire prevention. And as always, if you have ideas for future topics or questions, please don't hesitate to reach out. We're at podcasts@cityofkingston.ca. And on a personal note, we're going to be changing up the format for this show in the near future, so look forward to that. And that will mean a new host. So this was my last episode with this. I've enjoyed the last 2 years doing this project. It was sort of unexpected, but it's been great. I've learned a lot, and I look forward to seeing what Tell Me More becomes in the future. Thank you for tuning in. This is brought to you by the City of Kingston's Communications and Customer Experience team. Thanks.